Primary care. The National Health Service. The National Health Service (NHS) is responsible for health care for everyone in the UK, although a small number choose to pay for private care. Treatment is free, but there is a prescription charge for drugs and appliances, such as a cervical collar, with exception for some patients such as children and elderly. Primary care is provided by general practitioners or GPs, sometimes known as family doctors, nurses, dentists, pharmacists, and opticians. GPs work in practices of 1 to 20. Practices are based in surgery and look after the health of from 1,000 to 50,000 people in their local community. They also provide health education in areas such as smoking and diet. Run clinics, give vaccination, for example, for influenza, and may perform minor surgery, such as removal of warts and molds. If a patient needs specialist care, the GP will make a referral and refer the patient to a consultant in secondary care. Patients are normally seen on an appointment basis. Home visits are made when patients are housebound, unable to leave their homes, or too ill to attend surgery. Out of hours treatment from 6 p.m. to 8 a.m. is provided by the local primary care trust, which organizes a shift of GPs and locum GPs to cover if someone is absent. Note: the noun surgery has 3 meanings. The building where GPs work, the practice has moved to a new surgery on the High Street, a time when GPs see patients. Morning surgery is from 8:30 to 12:30. The work of surgeons: the patient needs urgent surgery on a bruised appendix. The practice team. A typical GP practice employs receptionists. They are responsible for initial patient contact, making appointments, taking requests for repeat prescription, taking taking message from patients and other health care providers, and filing and, and for filing and scanning documents into patient records. The patient manager has responsibility for finance and sometimes for AT. Supervise reception staff, hire, hires locums, and helps prepare the practice development plan. Practice nurses run asthma, diabetes, and cardiovascularity and cardiovascular disease clinics, as well as one-to-one clinics for those who wish to give up smoking. In addition to practice staff, GPs work with a number of health professionals. District nurses visit temporarily housebound patients, such as recently discharged hospital patients, to charge dressings such as ulcer dressing. Health visitors visit families to carry out checks up on young children, particularly under fives, to make sure they are healthy. Special attention is paid to families in need, such as those living in poverty. They also do baby immunization. Midwives run clinics for antenatal patients. Physiotherapist provides hands-on treatment but also teach patients exercise they can do improve their condition after an accident or operation. A GP's day. Dr. Stewart worked in practice in a small market town with three other family doctors. The surgery is in the center of the town and is shared by three practitioners. This is a typical working morning when she is not the duty doctor, responsible for emergencies and urgent problems. 8 a.m. Arrive at the surgery, check the OOH email, print out, check for urgent and non-urgent message. 8:13 a.m. Check emails from the health board and partners. Prepare for surgery. age 13 to 10, 15. Morning surgery, 10 minutes appointments. 6 pre-book last week. 2 book 48 hours ahead. 4 bookable on the day. 10:50 to 10:55 a.m. Check with reception for message. Sync prescription and deal with repeat prescription. 11 to 11:20 a.m. Coffee break in the conference room with college. 11:20 to 11:30. Check home visit request and divide up visits with college. 11:30 to 1 p.m. 11:30 a.m. to 1 p.m. home visit. Medical education 1. Medical education in the UK. Medical education in the UK covers undergraduate education 4 or 5 years at medical school, the section of university responsible for medical education. A 2 year foundation program, which provides training for new doctors after graduation through a series of placements in different specialties. Postgraduate postgraduate training which doctors take to become GPs or consultants. Senior specialist, often delivered through college for different specialties. For example, the Royal College of Physicians. Physicians. For example, the Royal College for Physicians. Continuing professional development in the form of courses and seminars which doctors undertake throughout their working lives to keep up to date. Extract from an undergraduate prospectus. The MBCHB Bachelor of Medicine, Bachelor of Surgery is a 5-year undergraduate medical degree course. Most of your learning takes place in small groups. The main components are core years 1 to 3, an integrated program of clinical and scientific topics, mainly present through problems based learning (PBL), where you work with others on a series of case problems. Students select modules. Students select modules, SSMs, allow you to choose from a menu of subjects, such as sports, medicine, or even study a language. As preparation for an overseas elective, a hospital attachment of your own choice of your own choice between years 4 and 5. Vocational studies and clinical skills. This component prepares for you for the clinical skills required for contact with patients from year 1 of your course through periods of practical training where you are attached to a hospital department or general practice. Clinical attachments, year 4 and 5. A series of 4 weeks clinical attachments in medicine, surgery, psychological medicine, child health, obstetric, and gynecology and general practice. A student's view. Ellen, a medical student, described her course. I'm just finishing my first year of medicine. What I like about this course is that you're involved, involved with patients from the very beginning. Even in our first year, we spend time in hospital. Much of the course is PBL. We have to we have 2 hour we have 2 hour section a week where we work in groups of 8 to 10 solving clinical problems. We decide together how to tackle the problem, look up books and online sources, make notes, and discuss the case together. It's a great way of learning and getting to know the other students. In the past, medical students had lectures with the whole class. Taking notes from taking notes from lectures from 9 to 5. But now it's mainly group work. Although, although we do have some lectures and seminars where we work in small groups with a tutor. I like all of it, even the dissection. We get to cut up cadavers from the second month of the course.